Promising news in the development of a COVID-19 vaccine comes as the number of coronavirus cases in the nation continues to rise. According to Johns Hopkins University, there are more than 161,000 new cases in the U.S. Joining me now to talk about where we are in the battle against COVID-19 is Dr. Jerome Adams, Surgeon General of the United States. Dr. Adams, welcome back. Great to have you on, and thank you for your time. As we see the number of coronavirus cases rise across the country, what do you see as key or most needed to reverse that trend?
Well, I'm terribly concerned about the trends. You mentioned them. In the last 30 days, we've gone from 50,000 cases per day to over 150,000 cases per day, almost a 300% increase. And that's translating into hospitalizations going up from about 5,000 cases per day, hospital admissions 30 days ago, to over 10,000 cases per day now. And I'm really worried about my fellow healthcare workers getting overwhelmed. I'm worried about people having heart attacks and strokes and being in car accidents and not being able to get the care that they need because the beds are full of COVID patients. So what I want everyone to understand is that what you've done so far has saved lives. It truly has, but the dynamics of spread are changing. More and more spread is occurring not in the public square, but in the household setting. And so we need to be especially cautious about our social bubbles, making sure we're not expanding them too quickly, especially as we go into the holiday season, being cognizant of the fact that each new person you're around adds to your risk.
I know that you've talked about what's being referred to as pandemic or COVID fatigue. Let's talk a little bit more about that and the possible dangers, and how do we as a nation overcome that?
Well, it's important for everyone to understand that we all have a role to play. From a federal perspective, we're trying to provide resources, manpower, guidance. But on a local level, everyone has to do their part. And I know people are getting tired. It's tiring when you're running a race and you don't think you're ever going to get to the finish. So it's why it's so important that people understand that this week we actually had 2 different vaccines have results shared showing that they were 95% effective. We will start vaccinating people within weeks. We don't need to do these things forever, but we need to be really cognizant about them right now. And when I say these things, I mean wearing a mask, washing your hands, watching your distance, and remembering that this Thanksgiving, the safest way to spend it is with the immediate members of your household only. But if you're going to be around other people, please go to cdc.gov and review the tips that they have for a safer holiday gathering. You can find them simply by Googling CDC holiday gathering. We've all got to do our part for a little bit longer. Otherwise, it's going to be a really bad next 4 to 6 weeks.
Any other advice for folks how to celebrate the holidays safely? Because people do want to gather and be with their families this time of year.
Well, if you're going to gather together, know whether or not you or someone who you're gathering with is at higher risk. Chronic medical conditions, diabetes, heart disease, lung disease, because those are people who really should stay at home. Make the gathering as small as you can, ideally less than 10. Outdoors is better than indoors. And one of the things I'm encouraging people to do is to be particularly cognizant about their social bubbles leading into Thanksgiving. Consider asking everyone who's coming to try to quarantine themselves before the holiday gathering, knowing that it takes an average of 5 days for symptoms to show up. The longer you can be not around other people, the safer it will be for you to gather together this holiday season. But again, 3 W's, wear a mask, wash your hands, watch your distance, and get your flu shot this year. It's not too late, and that's another way you can help protect hospital capacity and prevent from disrupting the holiday gathering. You don't want to be the one with a fever or a cough or a sore throat because of the flu, but scaring everybody and forcing them into quarantine because they're scared that you have COVID.
All right. Well, thank you so much. All great advice. We appreciate your time. Dr. Jerome Adams, Surgeon General of the United States. Thank you again for your guidance.
Thank you. CDC holiday gatherings.